Sunday, 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 Sunday. Sunday is a good day. Sunday is a hi people, hi people, hi people. Hope you all are doing good. Hope you all are doing great. Hope you all are having a great day. Yeah, hope you all are doing good. Hope you're having a wonderful day. It's another wonderful Sunday, like you all already know it. And it's a Sunday full of amazing surprises. Today we have very wonderful people that are on the panel. I see one of them already, and there are a good number coming to join to have this wonderful conversation. Like you all know it, my name is Wicom, and I'm always here with you every Sunday. So we have this wonderful conversation. It's always a very wonderful conversation. Hey, I want to send this special shout out to my beautiful followers, those who have been very, very active, those who have been very, very engaging, those who have always been there to actually make sure we have a beautiful broadcast like this, and those who have been active followers. I just love you so much, and I must say you all are the reason why we're here. And today we're live, and we're talking about depression and anxiety, overcoming depression and anxiety. This is one of the very striking and technical topics that you don't want to miss. You don't want to miss. This is something that has been really, really underrated. Underrated. So do your best to share to as many people as possible. Share. So we have as many people as possible following, and we have this smooth conversation. It's a wonderful Sunday. I mean, it's been a very busy one on my side, like you all know. We have the laughter extravaganza night coming up, and it's really been a very busy season on my side. I don't know what about you. Those of you coming in, do your best to share. When you come in, let us know where you're watching from so we can give you a special shout out. You know, it's our tradition to always give you all a special shout out and always celebrate you, And it's always a pleasure being with you all. I see some viewers connecting. As you connect, you share, you share to as many people as possible. So we have a good number of people watching. Share, and share. So we have this conversation. This is a very, very, very pertinent topic that a lot of people who are not here today would have wished they had a session like this to handle something as pertinent as this, something as technical as this, something as strategic as this. You see, so as you come in, you share, you let us know where you're watching us from, so we can give you a special shout out. It's always our role to celebrate you and to converse with you. We have some very powerful guests coming in, and they are definitely going to be live with us, and it's going to be a wonderful session. Oh, Akumenjel, I see you. Please, as you come in, you share. Happy Sunday to you. Hope you're doing okay. Let us know where you're watching us from so we can give you a special shout out. We can give you a special shout out. We can give you a special shout out. And yeah, we have Flair Tina. Good evening, Flair Tina. Hope you're doing okay. I mean, these are wonderful people. We have Agbo Testimony. Agbo Testimony, our very wonderful actress. A very wonderful actress. And she has another name. I'm not going to call it here. Sweetest. But I'll not call the rest here. Yeah. Agbo Testimony, happy Sunday to you and hope you're doing okay. Akumejes is watching in the kitchen. Oh, Akumejes, let us know what you're cooking, mom, so we can actually maybe after the program we could have a bite, you know. And I got Simon said I'm watching from Bonas, of course. Yeah, yeah, yeah. Bonas all the way. Hope you're doing okay. Now, Bonus is Bonus, and there's Bonus, the movie that is coming up this Friday. Please, those of you watching us right now, make sure you're part of the Bonus movie projection this Friday. It's going to be mad. You know, it's going to be a very wonderful, 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 wonderful broadcast. It's a comic movie that you don't want to miss. It's going to be music presentation, stand-up comedy, movie production of Modas, Miss Natural. I mean, the night is wonderful. All of this is going to happen at Laughter Extravaganza night, and you don't want to miss this. Happy Sunday, Flirtina. Flirtina, happy Sunday to you, and hope you're doing okay. Hope you're doing okay, and hope everything is okay on your side. This is, you see, she's here laughing. Sweetest beings. Sweetest beings. That's the role she's playing in the movie Bonus. The movie Bonus is a movie that depicts a whole lot of things in a very comic manner, and it's a movie you don't want to miss. So, all of you watching, do your best to be there on Friday, 29th November. That is this Friday, as from 5 p.m. the red carpet starts. We're going to have a red carpet music presentation, movie projection, Miss Natural, stand-up comedy. You see, and the movie Bonus was projected where Agbo Testimony is playing the role of sweetest beings. Just the name should give you an idea. Yeah. Okay, we have you see, she's doing great. Glad you're doing great. And oh, Flirtina is watching from Douala, 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 Douala. Yeah, hope Douala is okay and hope you all are doing awesome. Mami, the boy water for bad no. When we go to the kitchen to cook food, the boy order water na. Please, when you come in, you like and you share. Please, when you come in, you like and you share. So we have as many people as possible watching. Oh, we have a good number watching already. Yeah. I bet no boy water why cooking a chop. We have I'm watching from the movie Bonus, not the quarter. Yeah. She's playing the role sweetest beings. If you want to see what I'm talking about, when I say she's good, I mean she's good. Playing the role of sweetest beings. Sweetest beings is that one kind of person that you don't want to mess up with. Yeah, and definitely her beings is the sweetest in the movie. We have Hansen Mish TSC. Hansen. Hope you're okay. This is Lee Brown in the movie. We have talented people watching this live, eh? Yeah, it says watching from Jupiter. How is life on Earth? About life on Earth is the way it is. You see the way we are. See my jaw. Hope Jupiter is okay. How did you get to Jupiter? Did you use a spaceship or you went through the Elon Musk way? Maybe you tell us more. Now, Clara B, hope you're doing okay. Good evening to you. Please, when you come in, you do your best to share to as many people as possible. So we have a good number of people watching. Share on WhatsApp, share on Facebook, share everywhere you can share. That is how we get this number of watching. So immediately we got a good number of you, we're good to go. This is Mary Stella Kinney J. She's going in for the Miss Natural, and I really wish you win. And it's very simple to win. Well, anyways, during the Laughter Extravaganza night, we're going to know who's going to be the winner. We have happy feast of Christ the King. Oh, happy feast of Christ the King to every Catholic Christian watching. Loom Heidi, aka Mommy Sky, my very own Mommy Sky, watching from Bamenda. Hope Bamenda is okay and hope you all are doing okay. Sweetest Beings is laughing and she's like, don't play. Okay, Sweetest Beings, we are not going to play. We have watching from Banso. Hey! Venshati. All right, it says, Akume's children are watching. I beg, what Sweetest Beings? Sugar the inside. Yeah, there's sugar inside the beans. I think Sweetest Beings is going to tell us, going to come and tell us why it's Sweetest Beings. Okay, this Hansen saying they are okay in Jupiter. Oh, Jupiter. I think Jupiter. You tell us whether Jupiter is better than Earth, because here we have a lot of things I don't want to mention here before Facebook can flag me on our Instagram. We are streaming on Facebook, Instagram, YouTube. Yeah, that's how it's done. Yeah, nice topic. Definitely, we're going to talk about the topic in a bit. Do your best to share. Keep sharing to as many people as possible. So we have a good number of you watching, and we're going to have this conversation very nice, smooth, and as usual, it's always a very interesting moment. Has the topic changed? No, the topic has not changed. Though the topic is still the same: overcoming anxiety and depression. That's the topic we're handling today. Oh, Hansi says he's using Oku Airlines. Baba, you give me pass, oh. You give me pass. Me self go need that Oku Airlines for can't join you, because it did like that side, it make more sense. You give me pass. Yeah. Oku to the world. Oku to the world. All right, no network issue. This one they're saying their own. All right, people, we have one Felicitas. One Felicitas, good evening, and hope you're doing okay. All right, we've already had a good number of you watching. Now, ladies and gentlemen, like you know, it's never a lonely discussion. We have a good number of guests that are going to be joining us today, and definitely one of your favorite, and you see her again today. She had to do a lot of things so she could be part of this program to talk about this particular topic, because this topic is very, very vital. The kind of topic you don't want to miss. And we already have, I see, a very talented, he's cute, talented, and he's got a very magical inspiration, the kind of inspiration you don't want to miss. Yeah, ladies and gentlemen, we have, you know him, some of you know him, some of you don't, but I'm going to be introducing him with another name today. Ladies and gentlemen, let's welcome Jude Tencha on the mic, on the panel. Hi, Jude. How you doing today?
Hi, good afternoon, good evening to you all. Good evening, everyone watching right now.
Oh,
Many people
yes.
know me as John Perford. So mhm, let me say it once and for all, because the Jude
Yeah,
is actually the name that we were born with. But
yeah,
in this
yeah, yeah,
entertainment, every artist has his artist name.
yeah, yeah,
So
yeah, yeah.
which many people knows me as John Perford. Yeah, thank you very much for inviting me here
Wow,
today. I'm
wow,
grateful.
wow. So glad having you, brother, and glad to have you on board. You're looking awesome. You're looking awesome.
Thank
You
you.
should
Thank
not
you very
today,
much.
yeah, with the rockers today, pidgin English, French, anyone will correct. We just go
Now,
that good.
so, uh,
All right. We have some people saying, welcome. This is Akbar Testimony, sweet, aka Sweetest Beings. Welcome. Says, hey,
mm,
good greetings. We have one
yeah,
Felicitas.
so,
Good evening.
yeah, good
Oh, Akbar
evening.
Testimony says we know him. Yeah, they know you. Yeah, John
Wow.
Belfort. All right.
Yeah.
Say, wow, glad to have you here. And yeah. Okay. Now, dude, how you doing? I mean, how is everything? How's your day?
My day is good. My day is still going. Here, half 1 p.m.
Yeah.
Yeah, so the day is still going. I'm home. Today's weekend. So everything is going on smoothly, guys. Like, everything is fine. Now that we are on a good topic, I decided to join your program today, which is
Wow.
always good to join and share together.
Yeah, that's true. You know, sometimes when we just have this conversation and sharing,
Mm-hmm.
helps edify, educate, and heal a lot of people. I don't want to leave out the healing part of it, because
Yeah.
sometimes just talking like this and listening to people talk with a
Mhm.
similar experience helps a lot of people to heal from their own experiences. You see,
Exactly.
Brianna
Exactly.
Adeo says, welcome, sir. We have Fort Tabera says, well, good evening, sir. We have Rita Perry, good evening to you.
Thank you so
Uh,
much.
all right, please keep sharing. Oh, she says educate. Yeah, Definitely, we're educating. Now, you before we get deep into the topic, we I want to find out from you. How can we categorize, how can we define depression? I mean, in your own terms, it must not be.
Yeah, okay. To define depression, you know, uh, how can I say? There are people that have a lot of problems in this world.
Yeah,
First, when you are having a lot of problems and you don't try to be calm with those problems you are having, you can go into depression
yeah,
because you are thinking so much. Your mindset is not straight.
yeah,
You want to sort out all the problems once. You want to find a solution of that problem, and it's not going. And since the solution is not working as you want, you are having that depression.
yeah,
So for that, for people that are having depression, are those who are having a lot of problems. Their
yeah,
mindset are not really stable. It's not
yeah,
they are not steady in thinking when they are having depression. They just want to maybe harm themselves. Some of them, when they're having depression, they want to harm themselves.
yeah,
And
yeah.
which
That's.
is not the best solution.
Hmm.
Which is not the best solution when you're having depression. Now, when you're having depression, you have to be calm.
Yeah,
You have to be calm. Look for a calm place, maybe somewhere that you're gonna be alone, or there are also music that can make you think about the future. And if you are having family, it's exactly a lot of people have families. If you are
yeah,
having family, children, husbands,
yeah,
you have to think about them because doing something rubbish, doing something foolish that you want to harm yourself, you will definitely go and life will continue.
yes,
Life will continue if you are in depression and you want to do something bad. For
yeah,
you to really go out from that depression, you have to pray. You have to pray God and ask God for your solution
yeah,
because He is the key of our problems.
yeah.
So
That's
for
that.
anyone
That's
that is having depression, please be calm and
yeah.
ask God, please help me out to be out
Mhm.
of these problems.
Yeah.
So you
Thank you so much, Jude. Let me take this comment. This one says depression is having a low mood or loss of pleasure or interest in activities for long periods of time. That's why you become isolated. Now, I'm going to read another kind of definition. This one says
Mhm,
depression is a mental disorder characterized by persistent feeling of sadness,
mhm.
hopelessness, and lack of interest or pleasure in activities that were once enjoyable. It can affect a
Yes.
person's thoughts, emotions, behavior, and physical well being.
Mhm,
Symptoms of depression vary. They have persistent sadness or emptiness, loss of interest in hobbies or activities, fatigue or lack
mhm.
of energy, difficulty in concentrating or making decisions, changes in appetite or weight, sleep disturbances, insomnia or excessive sleep, feeling of guilt, wordlessness or hopelessness, physical symptoms like headache, digestive problems, thoughts of DEATH, I don't want to call the word here, or
Wow. Yes.
CIDE. You see, now establishing these foundations is going to help us understand. Please, as you come in, you join. As you come in, you
Yes.
join. Hi, Olivet. As you come in, you share. Hi, Olivet. I see you. This one's okay. This one's be careful in terms of depression. Yeah, Mr. Joe was
Yes.
only telling us some of the things which we need to be very, very conscious and cautious about
Mhm.
when going through the state. If we look at the definition and characteristics of this particular, it's a mental situation. I don't know
Mental
if it's
situation. Yes.
of this particular state, you will know that there are a lot of people we see, that are suffering from this. I know
Exactly.
of a lady that all of a sudden she just went mute. And one point is she used to be a very active lady. And
Mhm.
she'll be posting on social media. You will see her around you guys vibe. Sometimes you talk on phone, sometimes you hang out. And all of a sudden, she went mute. And I was like, what's going on? She says, a lot is happening. And
Mhm.
after that, I came to understand that she was actually going through this thing called depression.
Yes.
And this thing is one thing that if you are up to maybe 25, 30, or even some get it as early as 20, there are certain things that you
You
hardly
need to
miss.
avoid.
And if you look at it very well, it's usually as a result of a miss in your expectations.
Yeah.
You're expecting to have this, but you don't get it. You're
Mm-hmm.
expecting to have this behavior, you don't get it.
You don't
You're
get it.
expecting to have this interaction, you don't get it. So it's usually centered around expectation. Now, if you in a town like Yaoundé, for example, it's one of the town I've seen people talking alone a lot. You will see a man walking, and all of a sudden he just clap the hand. He's talking alone. You see? So if you drive around town, you see like a lot of people
Mm-hmm.
have this
Moving on
situation.
the street, even talking alone.
Talking alone.
Yeah.
Talking alone.
Talking alone.
Some are
You see somebody
isolated.
really talking alone as if he was discussing with
With people.
somebody. Like that's part of depression.
You see, let me take a few comments and then we're going to continue. This one says, in psychology, we call it psychiatric disorders. That one a
Wow.
big guy. That one big now. Viewers is very correct. Yeah, that's it, sir. Yes. But testimony says when you are depressed, you get to realize that nothing interests you anymore. Only things that have to do with CDE.
Mm-hmm.
Yeah, and this is one point. And she says correct,
Correct. Yeah,
exactly.
exactly. Yeah.
Okay. Anxiety is a natural response to stress or perceived threat characterized by feelings of fear, worry, or unease. Now, let me look at another definition of anxiety. They say anxiety is a feeling of worry, fear, or unease, often about something that is uncertain or
Mm-hmm.
uncertain outcomes. It is natural response to stress or danger. But when it comes to excessive, persistent, or irrational, it may be classified as an anxiety disorder. People with anxiety experience overwhelming feelings of fear or worry that can interfere with daily activities.
Mm-hmm.
Symptoms of anxiety, consistent worry or fear, even without a clear reason, restlessness or feeling on edge, rapid heartbeat or palpitations, difficulty concentrating or feeling like your mind goes blank, muscle tension or headaches, sweating or shaking, shortness of breath or dizziness, sleep disturbances, avoiding situations that trigger anxiety. Now, you know that there are a lot, these are the basic. We have depression on one point, we have anxiety on one point. And a
Yeah.
lot of people, especially in Africa, go through these two things or one of these two things without knowing. This one says depression can kill seriously.
Yeah.
More to me is it made me to be constantly sick. You see, that's what
Mm-hmm.
I'm doing. That's
Depression is a
mentally.
very bad something. It's something that if you are trying to go into it, you better avoid it because it can put you down. Yes.
Now,
It can
John,
totally put you down.
now, Jude, you I think, do you know some possible tips? How the first thing is how to avoid depression. Do you have some
Okay.
possible tips that could help us on how to avoid depression in the first
Yeah.
place?
All right.
Yeah, maybe help us with some
For
of them.
anyone to avoid this depression, first, when you already started feeling those, like, let me say bad, when you already start feeling bad, then you're trying to sort out your situation and they are not going, you need to be calm. That's what I said first. You need to
Yeah,
be calm because you are confused at that stage, at that moment, you are confused.
yeah,
Yes. At that same point, you are confused. You need to be calm, take a break in any other thing you are doing. Maybe you should go to an area where you have to be alone or talk to a man of God. Yes. You can
yeah,
definitely call a man of God or somebody that can advise you or talk to you well. Share your problems with that person if you actually trust that person. So that person can comfort you and try to bring you down.
yeah,
Those are the major things that you need to do when you are under depression because this depression that we see is something that can definitely can kill you down, can put you down. It's a very
yeah.
bad thing.
Yeah, because we see. I've seen a couple of comments of people that have been there, and you see the comment they're like, "I've been there." It makes you sick. You see, because
Yes.
one of the one time I came to understand that we need to really, in as much as we watch our health as the health, we go for health checkup and
Go
stuff.
for health checkup.
There's something called mental health that is underrated, especially in Cameroon and
Mm-hmm.
some parts of Africa. Because the mental health part of it, I came to understand how strong the mental our mind is. One day when I was trying to cut some fruit in my kitchen in the slab on the slab, I was cutting and the knife slid because when I have to arrange a fruit, the knife was on the tray. It slid and it was falling. It was falling straight like this, like
Yes.
this.
Mm-hmm.
It was to land on my leg. Now the knife did not touch my leg, but the thought of it made my leg to pain that day. You understand? As though it touched. And for about the next 3 to 4 hours, my leg was paining. The knife did not touch my leg, oh, but the thought of it made my leg to pain for the next 3 hours. Then I understood that a lot of these things we experience starts from the mind, and that's how powerful our mind is.
Yeah.
You see, depression is a mental state, a state of the mind.
State of the mind.
Expectations are not met. People get depression from heartbreaks.
Don't heartbreak,
People
yeah.
get depression from loss of money.
Disappointment.
People
Disappointment.
disappointment. Thank you.
Disappointment, especially if you trust somebody very well and that person disappoints you.
Yeah, yeah.
Mhm.
You see, disappointment. I've had. I think I have witnessed this, and my experience. Today we have my experience with depression were as a result of two things: disappointment, principally, and in a down moment, what we call down moment when business seems not to be working. You
Yeah.
see, my
Mm-hmm.
experience was there was a certain time where things were not working, and I had a lot of charges because running my daily activities and doing the things I do
Mm-hmm.
entails some, and the way my life is structured, I need those funds coming in all the time. It got to a certain point where it wasn't coming the way it was, and my responsibilities were adding. I saw how I was going down, pale, as all of these characteristics of depression, whether it's from disappointment, whether it's from loss, whether it's from whatever, you
Mm-hmm.
start noticing, you start losing interest in doing the things you love.
Yeah.
Started losing interest in doing the things. And I'm an artist. I'm an art person. I like shooting. I like doing videos. I like doing talks. I like doing. I just started losing interest in all of those things. Sometimes people can call me. I wouldn't even like to be with people. I wouldn't even like to communicate. You see,
Yeah.
in my
All right.
sphere, at the forefront where I lead and motivate people. So it
Another
was
way, another way too that people go into that depression is this, like all this, our young generation, those who like to fall in love, and maybe
yeah,
you try to fall in love with somebody that doesn't
yeah,
have your time. You really
yeah,
love that person, and that person doesn't have your time.
yeah,
Then, or maybe that person has been pretending to you, like the person loves you so much, and you
yeah,
also gave your heart to that person, that you love that person. At the end of the day, you discover that that person doesn't love you anyway. So
yeah.
for that, you may surely have that mental problem and be depressed.
Yeah, you see. So the thing is usually at the level of expectation.
Expectation.
And this what you're talking about is what causes a lot of people to get into this palava love. So this love we no go ever talk about it love finish. Is what gets a lot of people. Then I was talking to a small boy. That child should be around 24, and he's like, Grand, leave, I don't
Mm-hmm.
beat you a lot, Grand. I don't beat you a lot. Grand, I just find my way anyway. I feel make I don't make a grand. Not anyway. You know, it say anyway, it means that anyway
Mm-hmm.
actually bad on a good. You understand? So I was like, when I went to the Apple, where if from all indication, somebody that was more financially capable than he was came and
Mm-hmm.
snatched his tail, and now he's ready to do anything to make the money and to you see stuff like that.
Mm-hmm.
So that's. I looked at him and he was not really talking. He was not really talking out of his own will. He was talking as
Yes.
under pressure, as trying to prove a point. A lot of people have gotten into nasty things because of this. This
Yeah,
palava love,
because of this,
this palava love,
because
this
of love.
palava.
Yeah, but
I've,
how
I've,
about love
I've-
now? Something with the kilo. Now you
yes,
plenty people they get that depression for the back, especially our generation of today. You know,
yeah, because the love of our love. This one say love is KILING us. This one say the love no go
love
finish
is
here.
killing. I swear, the love the key very badly. So may we
It
not
require
fall inside those traps.
it require for that level. Now,
Mm.
answer me says
It
that
require, you
someone
talk
is
about that.
depressed and he is not aware. This is the truth. I myself I was depressed and I was not aware. Like I was saying earlier, the truth is this: when I started noticing that I lost anxiety in doing what I love,
Yeah,
I became very less creative and
exactly.
that I was less productive. So I started avoiding works. I was giving it to
At some
employers
point,
like
he
that.
depressed and he is not aware.
Yes,
I see a comment. Yes, of course. You are not. What is happening to you? You don't know it until maybe somebody closer to you will find out that what's happening to you.
yeah,
Because you'll be doing that without knowing. Maybe you are heartbroken and that is really disturbing you. You are there alone thinking you are depressed, and all those stuff. You don't even imagine that what you are facing right now is bad. But somebody beside you that knows you very well will definitely know that something is wrong.
yes. When you start behaving a way that you don't behave.
Yes.
Now, some of the ways you can be depressed without knowing it. You start acting rude. Everything
Acting rude.
annoys you. You see,
Acting rude
everything
to your
annoys
close
you.
people. Acting rude to your close people, those who you are really close to, like around you. You ask you that means someone will just ask a question, will just reply to that person as if he were nobody to you. Just that mindset. You are already
And
depressed.
like for my case, I this is how I came to know because I was not steady. You see me, I will sit like this and my brain will be far. I will not intentionally want to think. And I
Mm-hmm.
was sitting with some friends and all of a sudden they say, "Pa, you don't whistle." I say, "Eh, you
That
understand?"
that is what is happening. You don't know what is happening. It's not
Yeah.
you doing it. It's in the blood.
Yes.
That moment is in the blood, and if you don't control it, it will affect you.
Yeah. So I was just there. I did not understand. When they talk, my brain will be far, and my head is like, "What can I do? How can I do this? How to do this?"
Mhm.
A lot of things in my brain. I had to travel to a different town to actually get a soul moment and meet some
Good.
other people. You
Miss
see?
other people try to forget about what the past.
Yes. You see, trying to see how I had to leave my businesses, let other people do it. You
Mm-hmm.
see, had to do it like I did a whole lot because this is one topic that is really underrated. But if you look at it keenly, a lot of people are suffering from these things without really
A
knowing
lot of people, a lot,
because
like
we
50%,
take
60% of people in this life is suffering under depression. Yes.
yeah without knowing. You will see somebody just become so bitter. You will see somebody become just so rude. To
Mm-hmm.
some people, they become so humble. You see, it says
Yeah.
maybe too humble. It has a different reaction to different people that gives a different feeling depending on how they are and who they are. You understand? So some
Mm-hmm.
people have different reactions. Some people, these are things you watch out in somebody. When the person starts wanting to be alone for long, you
Mm-hmm.
need to watch them closely. When the person starts drinking a lot
A
or
lot.
smoking
Yes.
a lot, you need to watch them. One time after my experience, I I I looked at some things, and after my experience, I learned never to judge anybody
Yeah.
because the truth is, if you have not been through a certain situation, you always feel like people have control.
Mm-hmm.
You see what they call drug addict. You see, in Cameroon, we have a lot of people say, "The man a drunker man, the man a drunker man, the man a
They
drunker
don't know
man."
what to eat about they go through.
Yes, I can tell you, I can tell you for real, like about 80% of them people I say drunker people,
Now
they are
problems, depression.
depressed people. Yes,
Mhm.
they are very depressed. You
Mhm.
understand? In the midst of my experience, there were times that I would just live like that. During the day, I will not go me out there. I don't want to be with anybody. I just want to be alone. I will stay alone
Mm-hmm.
and go out. Sometimes I even avoided touching any car because my brain was always far. Sometimes at night, I will get up and stroll, just walk a bit like that. Meet some
Mm-hmm.
of these boys that are smoking and drinking and maybe
Yes.
gambling. Those are the ones that I started making friends with. I will sit with them and just try to understand how they think. I'll look at them. Some of them will be discussing. They'll say, Betty man, how you fine? Can't join me, take one. Take one, forget anything the world will just take one. And me, I'll just be there looking at them and trying to understand how they live their own. And all of them, if you look at it closely, people that are like that, they are like this. They are very
Yes.
close. They
They're
don't
very
need to know
good.
you. When they see somebody that shares their experience, my brother and me and you, they join and they take one and they take one and they don't. You see, it's usually like that. So in that experience, I came to understand that a lot of people we call drunker
Mm.
are depressed people.
Yes.
But
Something
simply
has happened
because
to them.
yes, they have an experience.
Mm-hmm.
Simply because we don't take mental health too serious in this part of the world, we usually miss it. We usually miss it and we don't understand. You see, I went to different town and sat. How do I call it? Knocking workers, those people that knock for a living.
So some people do it enough for a living, eh, boy.
Okay, if you acquire them, at least Max.
Okay, okay, I got it.
So if you acquire them, you see, then I met Hassan. There are times I met some acquirers. You see, the first time I passed another neighborhood, they thought I was a client. They can't what even caught my attention is they used to be in there's a road I used to pass that they used to be there
Mm-hmm.
before I get to my house. Now, and I'm passing, I heard one playing a cool with me, a cool with me. I said, I got to play with me, ha. You understand? So I just when I sat beside there, I got a drink. And I was thinking, well, like, Anna, you want to have any hair, I want to go arrange it for you, any style, blah, blah, blah. I said, Mommy, leave her. And it was an anglophone in a French
Mm-hmm.
place. You understand? She was English speaking, and I was like, eh, this is interesting. And looking, you look at her, you look at you really see somebody that is going through a whole lot. That the only thing, that she has to give out is her tutu.
Woo,
You understand?
are you
So
serious?
that's what she has to sell. So you know that a lot of people, the people that we categorize as this or that or junker or useless or gay man or whatever thing, a lot of them situations or depressions have
Situation,
pushed
yeah.
to be.
Situation.
And the
Depressed.
bad part is we hardly have this kind of conversations to enlighten them or to see how to come
Right.
out.
Let me say something. The main thing
Yeah,
is that problems never finish in this world.
yeah, that's true.
Problems never finish in this world.
Mhm.
And the only way to avoid having being depressed or being sad is do not put your mind or depend on people that much.
Yeah. Point number one, those of you who are watching, do not put your mind or depend on people that much. Yeah, that's very true.
Yes. If you depend on human being, because this human being you see can always disappoint you when you trust a
Yeah,
lot.
yeah, yeah, that's
Yes.
true.
For you to have all full confidence on somebody, you need to be very careful because if you are being disappointed, it will bring you down. You'll be
Yeah,
depressed.
yeah, yeah.
So
Because if we trace it where depression usually stems up from disappointment. Disappointment.
disappointment,
Yeah,
yes, from disappointment. A lot
yeah.
of people are being depressed because they are disappointed. That's
Mm-hmm.
the first thing. Disappointed because they were expecting something or they trust somebody and they were really counting on that person. They love somebody, and at the end of the day, they are being disappointed because it didn't come the way they wanted.
Mm-hmm. Yeah.
Yes, so they are having those breakdown from
Yeah,
there.
because that's one of the things. Now, in the course of I'm just sharing my experience because somebody might be having this similar experience. What worked for me that I came to understand because I was just there. I was basically existing, not living. You know, there's difference between living and existing. You see,
Yes,
you sit like that, isolation. Watch people that like to live in isolation. There are a lot of people that are repatriated to Cameroon. A lot of people
yes,
that
yes,
travel abroad with expectations that did not meet up.
yes,
They came back to Cameroon. A lot of them are suffering from depression.
yes, exactly. And I have one or two people that are in
Yes,
Cameroon right now, and I know their situation is bad, which
yes,
they were already in abroad, like living some little bit of good life. At the end of
yes,
the day, they were being deported. And you
yes,
know, back home when you are being deported, it's not easy to recover. All your
yeah,
mindset now is to go back. Going back
yes,
is not easy. And that's where
yes,
you are having that depression at that moment. Like you want to
yes,
do something by force.
yes.
You want to do that means you want to meet up
Of
with
course,
something by
like
force.
you're under pressure. You
Under
want to just
pressure.
out. You want the visa back. You are, yeah. I get what you're saying.
Mhm. And another one is some people are having these challenges because they want to compare with people.
Yeah.
Yes,
Yeah,
they want to
this
compare.
one is very important. That competition part is very important.
Competition.
Yeah,
Competition can put you to depress when your mind is like, I must do this by all means, and it's not really going faster as you want.
yeah, yeah,
Yes. So if you are having all those mindset, like you are doing competition with somebody that is maybe that person is doing well or it has something that you don't have, you want to have it by force and it's not going. Like you are just
yeah.
forcing yourself on something that it's not ready. Then you are having that
Yes,
down
you
part.
get that depression because I've been with some people that I'll talk about two categories. There's one that
Mm-hmm.
wanted to travel abroad at all costs. This
Mm-hmm.
guy just got up. He says he wants to travel. He wants to travel. He wants to travel. And now, when he had to, when he did, they struggled because they were looking for available line. If
Mm-hmm.
something only for you, mama me, they were looking for available line, and the guy had to go to one other country. I'm not going to mention the name now. He
Mm-hmm.
had to go there, and the line that they were following blocked when he was there. So he had to come back to Cameroon.
Mm-hmm.
Guy was in. I never knew that he was the one. Like I was walking around my entrance by 11:30 midnight. I walk at night a lot, especially when I'm going back home. When I finish late, I was driving past. I was like, "Hey, look at this boy! The guy was walking and he was talking alone. You know, at night in Cameroon
Yes.
is in some quarter is usually very quiet and calm. The guy walked alone and saw one container and kicked the container. I was like, ha, the man
Yeah.
can see also. So when I
Situation
finally
like
went
this can
back,
kill
I
you.
said, hey, boy, 90 the episode leave him. So I go to I took him, I was walking with him and talking with him, I walk with him and talking with him. After about a 15 minute drive, he told me that guy leave him. They don't deny me, they don't bang me visa. I was like, what?
Mm-hmm.
I don't go to go reach the place then I get for come back. So a day, I never know what they happen with me. I know you
That's it.
understand. I just sit down for that say man, I just come on waka.
At
I
that
was
same point now, you are the one to bring that person down, like to calm him down. If you don't,
yes.
you
You
can
see?
that person can definitely kill himself because he can go and say
Yes.
no, I don't have any life anymore because that was where he was depending.
Yeah. You
Mm-hmm.
see? Because he was just doing anything and anything that worked for him. Now, this is a case of somebody that wants to actually travel and his expectations are not being met. Remember, we said the key point is usually caused by disappointment.
Disappointment.
Remember,
Yes,
was a
the
person
keyword is disappointment.
that came back to Cameroon, like you were saying, because most people, when they come back, there's always this bush faller.
Yes,
Yes,
right. There's a good for life
abroad.
vibe that when you see them, you can
Yeah,
definitely be mad.
boy, mom, I don't come back now, so with my legs just kind of, you got to come out with Tundra 2014, 2022. You want to bring a 2024 car into Cameroon, you
Let
want to
me
bring that
let me
dash.
let me just give you example of myself about traveling stuff that gave me into depression once.
Yes.
That moment I was in Cameroon, and
Yeah.
that time I was little small, but I have that mindset of traveling. A
Yeah.
friend of mine came back from UK, and when this friend of mine came back from UK, he met me in the quarter. Then what he did was first he opened a shop to his girlfriend, a very
Yes.
nice shop to his girlfriend. I look at him, I say, Chai, this man, oh, see money, Chai abroad.
Yes.
Eh?
Yeah.
At that
Yeah.
point, I've never gone to the airport, even to even send somebody to travel and all those stuff.
Yes. Yeah.
Now, we were together all the time. This guy would spend money, and those time were the time that just small iPhone and iPad. He got one nice iPad. I was looking at it like gold. You get
Yes.
so the day this guy was traveling back, like
Yeah.
his family was going to send him off, and also I took a taxi that I must go to that airport to send him.
Yes.
I arrived at airport and this guy was flying. He left. You know, when you enter the immigration to travel, this guy was going and coming back to meet the girlfriend. I said in my mind, if I'm the one, I will not come back. As I don't enter, so now go. Huh?
Yeah.
And when he got his residence, means he can go in and come back, go in and come back anytime. You know, when you travel for the first time, when you don't enter, so you
Yes.
know, come back, you just the final road, you go now go.
Yes.
So that guy he left. From that
Yes.
day that guy left, and that I went and sent him to the airport to travel. I said in my mind that if I don't travel also, I don't think I will live. From that day, every day I'm thinking of how to do. So that mindset came into me until like every day I was depressed. Like everything I was doing in my
You
life was
wanted to just leave. You wanted to
yes,
just leave. You wanted to just
just
go.
leave,
You wanted
just
to.
go like him,
You
you
see.
know.
You
And
see.
that was
All
my
right.
first time also to see the flight leaving, and because I really took my time that day to send it on. My first time to go and send somebody to travel, it was like
Yeah.
crazy. You know, those are some of the things that make us go mad.
Yeah. Yeah. I get
Mhm.
it. I get it. That good. Now, ladies and gentlemen, we have mother of the boys, mother of boys in the
But
building.
yeah,
Hi, mother of boys. How you doing? It's your lovely mama Sita.
Hello, everybody. I'm fine. Oh, I'm fine. I'm fine.
No, from
I,
your voice, it says
hey,
it all. It says it from your
is
voice. It
that
says it from your voice.
Ambassador or is somebody else?
No, this is Jude Tencha, aka John
mhm,
Belfort.
Why
Yeah,
you
me.
yeah,
know?
Yeah,
Okay. Nice
yeah.
to meet
Now we will equally have your one of your favorite as well. This is Coach B. Coach B, always glowing. Hi, Coach
Coach
B. How
Jesus.
you
you. Coach,
doing?
I came to see you. I'm not really. I really want to hear Coach Victor because I know he has so much to talk about this topic.
Hi,
Yeah,
Jude.
yeah. Hi, Coach B. How you doing?
I'm doing
Coach
okay.
B.
Thank you.
And glad to have
Hi,
you.
Mama Sita.
Hi, my own coach.
Now, because before you and Mama Sita came in, we've been talking about depression, the different experiences. We already established a definition. Now we are looking at different experiences ranging from disappointment, which is a key, which is a key cause of it, and from heartbreak, business failure, loss, or whatever that disappointment. Now, Coach B, you are a life coach, and that is why I'm really glad when I see you on
Hey,
this live. What could you give us as other causes of depression?
Okay. We're talking about depression today, and there are so many causes of depression. And when I would like to try to simplify this as much as possible. So we're going to use the
Yes.
most simplest terminologies to describe
Mhm.
some of the triggers of depression. What causes
Yeah.
depression is as easy as high expectations
Yeah.
disappointments in life. So,
Yeah.
depression, again, we should be mindful of the fact that some of these mental illnesses can be hereditary.
Mm-hmm.
Yes, meaning you can have a family history of that, and then someone else down the lane can have depression or any other mental illness. I don't know if you know you're not on video. Okay. All right. So, one of the key factors of depression is anything that triggers you through maybe your emotions, your psychology, your social ability.
Yeah,
That is you being able to socially interact with other people. And some
yeah,
of those events can be as described in maybe natural disasters, it could be war, it could be heartbreaks, like you mentioned earlier, it could
yeah,
be grief. It could be grief,
yeah,
and grief is unavoidable. It could also be failed expectations, it could be a failed initiative, or it could be a failed business.
yeah, yeah.
So when I say expectations, we might think it's vague, but having expectations, the simplest expectation that most people have is a spouse having the expectation that the other spouse is faithful.
Mm-hmm.
And then all of a sudden, you realize that this spouse is unfaithful. It,
Mm-hmm.
first of all, it shocks you. And then you go through all the stages of grieving that person you thought he was or she
Yeah,
was.
Mhm.
Because if you thought I was that calm, collected, faithful person, and then all of a sudden you come to realize that I am the
yeah,
reverse of what you thought I was. It
yeah,
puts your emotions, it puts your social ability to even interact with me, your psychology at shock. So, because of that shock, it can put you in a state of depression.
yeah,
However, nobody is called depressed until diagnosed depressed.
Yeah.
So in
yeah,
most cases, we say we are depressed when we are just having a mental shock, or maybe we're just destabilized by that thing that triggered our emotional health or maybe mental well-being. Until when you're diagnosed by an expert, I would say let's not go about saying that we're depressed, because we are oversimplifying the term to the point where people who are truly depressed are not noticed. And by that, they get into that worse or that advanced stage of depression because we've normalized the word depressed. And anybody just says, I'm depressed, I'm depressed, I'm depressed. Once
no,
you feel like you cannot manage your emotions, the things that you used to process easily, you cannot process them. When you feel like you cannot get enough sleep, you can go to bed, but you cannot stay asleep. You get easily triggered, like you get easily angry than you usually were. You love to stay by yourself. You struggle with even getting showers or maybe taking good care of yourself or looking good, dressing good, well kempt, and all of
yeah,
that. When you notice that those things have changed, even if you do not notice it, some of the people around us can notice it even more than us.
Yes.
So when
Yes.
they notice that and remind you, maybe call it out, hey, Bonita, why are you this pale? I've noticed that your eyes are constantly red. Are you having enough rest? So go to the hospital and see a professional. It could just be at that stage where you just need a small conversation to
Mm-hmm.
kickstart, to get back to your normal life. But if you don't, now it takes you to that advanced stage where before you see an expert, you're already at that stage where you probably need to be on
Mm-hmm.
antidepressants.
mm-hmm. Now, Coach
I don't
B,
want to
how?
talk about this. You know, I'm very passionate about mental health, so I
Wow.
could
Yeah,
just keep going. Yeah,
yeah.
Wow.
Now, Coach B, it means the only way we can know we are depressed is by seeing a professional.
correct. But
Now,
you're
what
going
if?
to see the symptoms. You're going to have the symptoms. It's just like malaria. You start having vomiting, you start having a fever, and you're having a headache. But when do you diagnose that you have a malaria? A certain type of malaria is when you go to the hospital, a doctor consult a doctor, and then run a test. In this case, you're going to see a mental wellness or a psychiatrist or a mental health doctor who will walk you through the process of diagnosing which mental illness, because you could say it's depression, meanwhile it's anxiety. You could say it's depression when it's trauma. You could say it's depression when it's schizophrenia. So there are so many different types of mental illnesses that in most cases we can even call a bipolar depression. So in
Now,
most cases, you should go to the hospital so that an expert will diagnose you. It's easy for them to just talk to you and diagnose you.
All right, Coach B. This is something I want us to be a little bit more practical. Yeah, what you're saying is the right thing and is actually sane and logical. In Cameroon, in Tatum,
Right.
where I'm from, a village in Bamenda, you have somebody that maybe has lost his house and everything, and he's just worthless, useless, and working and drinking afofo and fighter and yondo anyhow. How do we actually help this particular category? Because what you're saying is not really common here. A lot of people here, I
Mm-hmm.
know the sense of why we do this, but the truth is, a lot of people here, my head is hot, my head is hot. Give me one cure for them, my head is hot, my head is hot. Find me
Yes.
one hot, hot, my head is hot. Don't be, give me mimbo. Like you want to drink, you drink your all of your money to the last penny. You go and meet other guys that do this one, they do it, and they will always gladly receive you. When you go looking worried, they'll say, boy, wait to be a poem. They say, boy, I get plenty them. They say, "Hey, take the one whole life, take the one whole life." Those are remedies that people here, that's how a lot of them cure these things when they start having this kind of symptoms. Now, looking at a place like where we are, where this particular approach is not really properly communicated, it's just so bizarre to see somebody going to a hospital in this place where we are, like, I'm suffering from depression, doctor, help me. That's about 2%.
The problem
Yes,
is
the rest are short.
hard.
It depends on how, boy. Come over here, it depends on. Sometimes even me, they talk. A friend of mine went. Okay, see what happened. A friend of mine went to see a doctor, and
Oh,
he was suffering from issues, and he got addicted to this. First session, doctor talked to him. Second session, doctor spoke. The third session, doctor said, "Boy, if you say by the suffer that thing, I see my own cure."
no way.
You understand? In fact, they both of us became friends. It's not the same thing. They were like, bro, forget. You understand? So,
Right.
in a
Right.
place like this one, where mental health is highly underrated, most of the
Yes.
time we call depression, like you said, when it's maybe something else. But one thing I am sure of is disappointment push people to have an unbalanced mental state.
Yeah.
Disappointment of mistakes, disappointment for wanting to fall bush. Boy,
Mm-hmm.
manga, don't hit me. Manga. Recently, there was a guy that actually committed SUICIDE because of human palava.
Mm.
And the person talking the story was somebody that almost committed a similar thing because of human palava. Whether it's bipolar, no, but that's not bipolar. Whether it's anxiety or depression or whatever, that is a category. My principal worry is about people that are going through these things. My business don't fail. All thing, my transaction need to come out. There were times that maybe I had some entries. It got to a point where the entries are tile like in village people, like it was really blocked. Me, myself, me. I hated doing the things I love. Like I lost my identity. I hated doing the things I love that I would normally do and get joy. Me, I hated them. Like I never wanted to do them again. I wanted to just be aside. I was not creative. My brain was not that functioning much. Like I could not really. You get me a job, I need to take a longer period to do it because I need to struggle for that 30 minutes of my time when it looks like I am almost fine. I just do it rapidly so that I don't miss out. People come to me because of the result they get. And times when I cannot deliver like that, I have to delay for some days until I get myself in that 30 minutes in one day to do it. It's the case with many people. You see, there are others that have been from a cheating partner. Our the manga, a man is a manga, don't carry different man, they fry, they give 7+1. You understand? There are others that might be going to a new place. A lot of people, that travel abroad, their early years, they suffer from this. Now, I don't just want to enter abroad because they have maybe a more developed system and approach of handling it. I'm talking about somebody in Kikaikilaki. Eh? That may be a new young boy like my head here with big face has maybe come and put a nonsense Benz and taking away his girlfriend. You understand? People like that going through that in a place where Do they even know what mental health is? They don't even know what mental health is. They don't even know that I dey go see the doctor na time my fever do me. When my temperature high, I go see doctor. When I dey vomit, I go see doctor. When my woman do belle wan born, we dey go see doctor. But my head dey hot, now my head dey hot. So I'm looking at the approach more from the people that call this as my head dey hot. My head dey hot, my head dey hot. How do we handle this situation?
That's a very good question, a very legitimate concern.
Yeah,
However, do people even care about their physical health?
yeah.
Those people who say my head is hot, do they even care about their physical health?
Uh,
Because most of them, even when they have fever and malaria, where do they go to? Do they go to the hospital?
oh boy, grass.
They don't go to the hospital. They don't. So it's all about sensitization and self awareness.
Yeah,
Because a few days ago, I was talking to my elder sister back home, and she was actually shivering with fever. She's having joint pains, she's having headache, she's having fever. And those
yeah.
are symptoms of different types of illnesses. But she had already self-medicated herself with malaria medications.
Wow.
But that's somebody who is in the city of Bamenda. So what's the difference between that person and the person in the remote area? I used to work
All right.
in Misaje that's in Dongamanton, right?
Yes.
Misaje is in Dongamanton. And every young girl there had a baby. But there were health centers there that preach and sensitize about birth control. So, what I want to say by that is if people are not aware of their physical health, then they will technically not be aware of their mental health. So, it's not because they don't know what mental health is, it's the level of sensitization that we need. Because even a general practitioner can tell you that you should see a mental expert depending on the kind of symptoms that you communicate to them. So if I'm a medical practitioner and I'm supposed to consult for general illnesses, and you come in complaining insomnia, you've not been able to sleep, you're struggling because of something that happened to you, maybe you're going through a divorce, your partner abandoned you, things like that. When you go to a doctor, those are some of the conversations that you have with them. Hey, I
Yeah.
just realized that my wife has HIV and I would like to take a test. First of all, they counsel you. So counseling is one of the very first stages to mental consultation. Meaning, if they have a counseling session with you, it means that's an opportunity for you to share some of the things that are bothering you. And that is therapy by itself. So there
Yeah.
are
Now,
counselors in hospitals. You don't need a soothsayer to tell you that. It's just that we have decided to be less conscious about our health in general. It's not just about mental health, because even physical health, people don't take care of themselves. Women are pregnant for 9 months, they've not been to any health center,
now,
and they're about to have the baby, but they've not been to the hospital. Women have kids in the house, and they don't trust vaccination. So it's about a cultural thing. So the more sensitization, just so that people are aware that so long as you can be physically ill, you can be mentally ill. And if you're mentally ill, it affects your physical health. So check your mental health even before checking your physical health.
now, this is Coach B, you done?
Yeah.
No, cut. All right. This is one thing. This is one part that is good. Mental people learn to keyword counsel. I know what I'm saying. No, I've met people. You meet somebody. The only thing they know how to console, they only console you when they want to give you a bad news, like okay, maybe the person they are operating has passed on. They'll say, bro, calm hard, calm down, come let's do this, come let's do that. That when you go and complain some things like doctor, manga get you one. The first thing like HIV, the first thing they'll do is there's someone, big shout out to Difo Nikki. That's my G. She said something like let me locate her comment. She said, I usually experience real depression in the hospital The moment in a client HIV becomes positive, that is one. He's going to comment that, okay, this is divine syndrome. Big shout out to you. Big shout out. Hope you're doing okay. He says, though everyone knows when they are down and heading towards the path of frustration, very few people, especially in developing countries, even know what depression is. What you're saying, Cosby, is the right thing. I mean, there are very few people, including medical personnel, that are saying they should be counseling people. Because a situation that they are supposed to counsel the person, they say, boy, confess. You know, with men, guys are funny. Guys are very funny. Guys connect like that. Eh? When they want to tell someone, they say, boy, confess. Some people never get the kind of thing for their family because there's a situation that they not even counsel you like that, like taking you as though they are counseling you through a
No, but
counseling.
counseling is not supposed to be too formal. So when if I would want to imagine what you're describing as someone trying to make the other person comfortable. And that's
Yeah,
what a physician in the state of counseling should be able to make things easy. I remember when I have been announced, or maybe a doctor has had to announce deaths to me several times. And what they do is they try to make you to be more comfortable before they announce it to you. So in most cases, some of these physicians are trying to simplify it, befriend you, make you feel like they can be close to you so that you can be more open to them. Again, I know that there are some people that can be very close friends to their physicians, but I don't know if it's the right practice for you to be a friend to your physician because it also oversimplifies things. But a physician making you comfortable in the middle of a session, it's another way to open up, to make you open up even more. Because, most of us are too secretive and we hide even things that can hurt us, can even damage our future.
yeah.
So in some cases, the doctor will just want to make it a very friendly session so that you can open up with other things. And someone talked about HIV. Yes, it's what is the worst case scenario when you take an HIV test? Is that you will be positive. That's the worst case scenario. But should you be ready for positive and negative scenarios when you're taking the test? That's what they should counsel you for. So you should be ready to receive a positive or a negative. It doesn't take away the anxiety. So it's not even depression. At that stage, you're anxious. You want a positive result, yet you're scared of a negative. You want a negative result, yet you're scared of a positive result. However, during that moment, your emotions are thinking of the things that you might have done that could possibly put you at risk of having a positive diagnosis. So it's normal biology for a human being to be anxious. It becomes an illness when your anxiety now starts causing you to harm yourself. That's where it becomes a problem. All of us, people get anxious, people get stressed, people can be depressed, but once it gets to the stage where you can harm yourself or you're not productive, that's when you need a mental wellness expert so that they can support you through that.
No, Cosby, I want to shoot one sharp question. Now, is what's the what I want to find out because from the characteristics and the feelings and the experience, anxiety, there's just a very thin line between anxiety and depression. How could we differentiate these two? Is it mental illnesses or mental situations or mental whatever I can put it?
Yeah, so when someone is anxious, anxiety is mostly like you just start having panic attacks when you're about to do something or when something is about to happen. So people get anxious or get anxiety attacks when they're about to fly. So it could be as simple as probably your system telling you that you either have a phobia towards something or maybe you just being uncomfortable. So most people, if you've ever taken for those who have taken an interview, in most cases you struggle with anxiety when you're about to take an interview because you're worried about the outcome. So you really want it so badly, and so your emotions are all over the place. They are looking for an answer. They are looking for a quick outcome. So it makes you edgy. So that's anxiety. But depression is what will keep you moody. It will keep you not wanting to even take a shower. It will keep you not even wanting to do your hair. It will keep you very less interested in things that you used to be interested in. It will keep you very uncomfortable around the people you used to be comfortable around. So you just want to be by yourself, especially the things that you used to have fun doing. You stop having fun doing those things. So that is where you're in a state of depression. You're unhappy. You're just sad all the time. And people
So,
even do things that used to make you happy. You cannot be happy.
mhm.
So that's the
let,
difference between the two.
all right. If I understand well, anxiety has to do with expectation, while depression has to do with something that has happened.
Exactly. Kind of. Yes.
All right, not far
Yeah.
from the truth. This one says, but wait, is there mental health part of general? Is mental health part of general medicine practice, or people in Cameroon have a special have to see specialists for mental illness?
No, it's not in their domain. So, but they can have that preliminary conversation with you. So you can tell them some of the symptoms that you're having to a general practitioner, and then they will refer you to an expert for you to be diagnosed.
Okay, let me take this comment. You know, mental health disorders cannot be handled by all doctors. However, in our recent project on depression, PHQ was the best diagnosis test, which we used, which we used which we used also capture all those who were suffering from mental disorders. If a doctor does not does if a doctor does know the tools, he will just advise the client but can't solve or discover the real problem.
Yeah, they
Now,
can help you. You would only have those preliminary conversations with them, and then they will refer you to an expert. And that's where an expert can now continue the diagnosis. They are the ones that will diagnose you. A general practitioner will not diagnose you of a mental illness, but they can consult you. Meaning you can go to a doctor and say, hey, I've not been sleeping good. I've been struggling with sleep. I've been sleeping and having some weird dreams and all of that. Then the doctor will put that down and either refer you to a wellness expert who will follow up on that.
all right, we have this other comment. This comment from Nicole and for Nikki. She says, "Coach B, anxiety is when you are waiting for the result, but the new method of test and treat leads many positive to depression after 2 weeks." Now, this comment is leading me to there's an experience I know of a lady who is of late, and this lady,
Can I step away for a minute?
yeah, sure, no problem, no problem. Now, this lady was diagnosed of the HIV, and just the situation, she stopped taking her medication.
Huh.
Now, in that line, you know, I come around, they decide to send a village people, they decide to send another one. I don't know why we like over these village people thing too much. Yes, it's a spiritual part of life, but sometimes these village people address simple malaria that we refuse not to treat. Sometimes we should just even do our possible best to take care of ourselves. You see, because this lady stopped taking her drugs, and the person I was saying was like, they need a strong man of God to pray for her and to follow even country. Yes, 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 yes. I used to have a pastor friend of mine. I call her. What did it happen? The first question he asked me was that you get HIV now. I said no, I don't know because they say spiritual people say they go hospital and this is what they do. They say they go hospital and you see anything. You understand? They say okay, he will come, but he never called. It's like maybe he had the ability to see beyond. And now, when that lady passed on, that was when I was actually told that she was having that situation, and because of the disappointment, she never followed up medically. And I'm like, what is the essence of all this? Why will you attribute a medical situation to village people? You know, say nothing that way they suffer from. Why you know don't take your antiretroviral? What people don't know is that there's a time when you take antiretroviral until it's not detectable in your system. There's a time you take antiretroviral until the thing is not detectable, which I think people need to hear this a lot so that they can be able to handle this. Depression that comes from this. You see, because there are a lot. I think Tifoniki is a medical expert. If I stand to be corrected, Please, I think you should help us enlighten us on this. Those who are having HIV, please, 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 do your best to follow the medical routine. It's very important because a lot of people have gone because of this negligence and not because it's something. They just go and say it's village people, it's jazz. They don't do jazz. They don't like me from my workplace. They don't want the man succeed. Why they go hate you?
Miss,
Now
you
you
know,
be first time to do the way they do am. You
yeah.
see?
Let me tell you something. There's a friend of mine, here. This one not even white. This girl, she used to be straight. You know the one
Yeah,
that straight, yes. So she dated men, all of that. So she was really enjoying herself. So now this
yeah.
other girl who was not straight, when I say who was not straight, you know what I mean. No. So
Rainbow people.
yeah,
Twilight or PD,
this girl,
they don't know PD, yes.
no she kind love talk. We not talk about this girl. This girl switched from being straight to being the other one. I don't know how you call it. So
Uh,
they,
PD.
so now they even got married in church and all of that. So when they got married, that's when this girl started. It nag, it whip her, it beat her. She need to get black eye, the can't walk. We asked her say what is wrong. That's where her this thing start kicking because it fear for leave the girl. At the same time, he need a companion. So the fear of not having a companion, they could make her stay for a relationship. Then the be no, the be black and blue.
Yeah.
Yeah. So this girl it got to the point where the girl now decided to go get a different girlfriend. He get now
He go
fall.
back, he go back for a Twilight style.
No, this when they don't even married though, he got to follow the other girl. He go, no, not my friend. He got to follow a different girl.
Mm-hmm.
This my friend. He be so
All
like
right, the person they follow different girl now, the guy will go to follow different girl.
no, no, like now two girls they married. My friend married the other. He married a girl.
Okay.
Yeah. So no, my friend no, he be straight. Ma talk about he be straight. So you know they
Yeah.
in there before. So he be actually like for date boy them. But this girl now come.
Ka
As he
arrange sute
yeah, he arrange
it
he
from big
change
Twilight.
yes, he join them. As he join them now
Mm-hmm.
they married, they even married for church. Now he started BT. He BT black and blue. He the one can walk like this. That's so idol black. With the one asking he don't go tell the other people they can't tell me. Then that his friend too, that his woman, I be know you but we were not friends. This
Mm-hmm.
girl, he do as you take, he started gradually the slip off. He started take drinking as his best friend.
Mm-hmm.
So as he started drinking now, so he drink in such a way as then this girl I can't leave you again. This girl will continue say me don't be like he leave you. This girl drinks to take he almost get this thing, kidney failure. Because of what? She was depressed. He said,
Hmm.
you convince me I do this thing, you beat me at the stay bed at the end, you can't leave me, can't this thing. He go consult, they give you all these things. Then now he come back, they seize it for they take it go for the one day, they take it go therapy. He go stay one day, he go now one day because when you want go therapy for yeah, like no this thing counseling, I don't how it be like therapy we go. So they begin for go put it for some place.
Like rehab
Rehab,
center.
part of rehab and therapy at the same time, yeah. They go put you for rehab where the condition like you are not supposed to communicate with any other person. They're supposed to take your phone. You're supposed to be there for a week for them to monitor you and make sure you're fine and all of that. This girl ran away just one night. She ran away from that place. They came and continued her drinking. Guess what is happening to Hannah? The kidney, you know, get kidney. It been on the a girl of 35 years. She's on
Oh,
yes, she's on dialysis because what? All these things led to depression. He start drinking now, so life no be straight. Now you work and find who could give you a kidney.
oh, she's quite young, man. Chai.
Yeah, I'm like depression can lead you to do terrible things. She was like when she wants to come to my house, she'll use this thing. She'll use this bottle water and put all this alcohol, this water, and put it inside. You think it's water, but it's not water. It's alcohol. She said,
Tony.
yes. She'll tell me that's the only thing that makes her happy at this moment. And then the thing is that she was not even eating. This girl be paid. Just imagine why the girl will not even get botox. Then that way small. Nothing is stand for you for a waist.
You did a rope now.
Yes, when wear close so when he close so the drop na drop. He get for the tie this thing there because of what all of this led to depression. It take medication. It get anxiety and they get depression. They get other stuff they worry for on top.
Oh,
All this bad stuff.
this is really sad. I mean, this is really and this thing that two people will go through, but it really
Yeah,
be like we don't talk about this. We haven't spoken about this enough. Like to me, if we talk about this, maybe just for 1, 2, 3 months straight, like for people to really get the kind of awareness they need to get, especially looking at audience from places like where we are. This place where they so they don't even talk about this. It's even good to, like those of people that out you have the medical system and even the every like it's really enlightening. We for here, now my head is hot oh, now my head is hot. You see,
yeah, yeah, that's the thing because now and then the thing is she will wake up and call you in the middle of the night 2 a.m. because she cannot sleep. All these things she cannot sleep. She don't want to eat. All and then she's looking for someone to give her a kidney. She will call you in the middle of the night. She wants to talk to you. Can you talk to your friends to see if they can give you a kidney? At the same time, you are still drinking. You have not stopped drinking.
yeah,
So
because she's depressed and then depressed again because she's looking for a remedy to
yes,
cure
and
something that the depression
she
caused.
her medication, the medication is not even working because she drinks on top of it. You are not supposed to drink alcohol. She's on antidepressant, like you are not supposed to be drinking alcohol, but when she takes the medication, she drinks, she don't eat. I'm like, I cannot help you because just imagine someone who sacrifice and give you a kidney, and then you are not even taking good care of the kidney. You still go and drink and mess it up. Who will be happy to do that? Nobody wants to help you. You are your friend, they're the same. The other one, you know the best okay, where Becky, because there are two of them, but the other one, I'm not friend with the other one. Where deny for say you cannot give your kidney, it want keep malice, you want kidney vex. You cannot be angry with me for refusing to give you my kidney. You messed up your own. So try to get
Yeah,
other people to help you.
yeah,
It, it's a sad thing, because people
yeah.
are like,
It's really sad. Let me take a few comments. This one is coming from Sunjo Optionnaire Gilbert. Greetings to you, big bro. It
my
says, I
God,
love the topic for today, and the resource persons are just on point. Yeah. All right. This one again says, a lot of time people are also more concerned about what people will say instead of taking care of themselves. Yeah. These are a very, very key point. Now, this experience which Mama Sita is saying, I have a similar one. You see, now it's about a guy that used to be an artist in Cameroon. He traveled out because he wanted to make more money so he could do the thing he's doing so well. It didn't work out. This guy, he was actually into gospel music, but when he traveled, he wasn't going out. He resorted to not the ordinary tobacco, but the other kind, cool. He started drinking cool. So there were times that guy will call me, and when I hear him speak, I just understand he needs somebody to talk to. It's like, bro, you remember that time I go to that video so bad. I just remember, and I'm like, this guy is gone, man. And I'm just observing. Sometimes I will just sit and allow him to speak, and will speak and speak and speak, and you start seeing him feeling comfortable and vulnerable, and I just be like, this guy is depressed. How do we solve this situation? You see, so there are many people in a similar case where they are in a state where they need to take medication, but the state where they are is making them do things that even the medications can't really help. You see the point? And
even
the
when
next step to,
there are some people on this antidepressant, and then two sides this thing watch. They cannot eat normal spoon.
mhm.
It's like anything that can make you quiet yourself, you be take away from them.
Yeah, yeah,
Okay, any you just feel like life is not worth living. But at the same time, I'm scared for this my friend because he might be like, okay, nobody's helping me. What am I living for? The 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 Imami to not tire because Imami she only has two girls and then all the one can be like the other one. You know, get no grand piki. Imami don't say me they live their life. She say they don't go here for you. So it's like it's just crazy. This guy is really going through a lot. But the thing is, you cannot call me at 2 a.m. I tell you to just sit on your call and be talking to you like that. It's
Yeah.
fine for them, but the thing is sometimes they're not some of them are not helping themselves. Yeah, you have
No.
all the help you can that you have all the help, but you don't want to take it. You don't want to go to the tap. You don't want to stop.
Now, Coach B, there is something which I want us to really to really you are a life coach, and I'm very glad you're on this platform on this podcast. I want to find out. You see, these particular situations, we always have a wrong approach when handling it. Like you see, the lady which Mama Sita is talking about, we always have an approach that a lot of the time we even try to think of the right thing to do when it's already almost too late or too late. Now, I want to find out something from you. What could be the possible things that one can do when they start noticing symptoms of depression or anxiety in them?
That's a good question. I think, and I'll still go back to talking about our mindset, and our cultural setting has built a certain lifestyle and a certain mindset that it takes an army to shift that mindset.
Yeah.
So the same way that people use the wrong ways to manage their physical health is the same way people are using the wrong approach to manage their mental health. It's not that they don't know that they are emotionally unstable. They do
Mhm.
know. Because when you're going through a heartbreak, for example, you know that you're going through a heartbreak and you need to talk to someone. And even if you cannot talk to a professional, you can talk to a trusted person. And that
Mhm.
is why sometimes I'll tell people, when you think about making friends, I have someone who taught me something so many years ago that if you close your fist like this, your thumb can cover just two of your fingers. And so if you have more than two friends, then that's a crowd. That's for me, I can cover two fingers. And I think some people who have longer thumbs can cover three. And so if your thumb can cover three, then you can have a maximum of three close friends. The rest are acquaintances. And so when you have three close friends, how do you choose a friend? You choose a friend, that friend who empathizes with you, that friend who shares with you, that friend who understands you, that friend who loves and cares about you. And so if you're going through something, meaning you lost a job, you lost your partner, you had a disappointment in your business, who do you talk to matters. So, are we going to churches nowadays to use the reverend fathers and the pastors as counselors, or we are just going there because we want a quick miracle or quick healing? Because that healing begins with you having a counseling session with some of these people.
Yeah.
So in our society nowadays, it has to start with a mindset shift because we've grown in a community where if you tell your friend that this guy broke your heart, your friend takes it to the next friend, the friend takes it to the next friend. And before you know it, you're not just struggling with the trauma of losing a boyfriend, you're struggling with another trauma of people laughing at you because it happened.
Very common.
Exactly. So now we have fewer people to talk to. Why
Yeah.
can't we be those people that anyone will want to talk to? Because I'll always say this, and I'll say this to any client. If you want to tell someone something and you start by saying, I beg, I did talk now only for you, I never tell no man, it means you don't need to tell that person.
Yeah.
That's already an indication that you shouldn't tell that person.
Yeah.
But if someone were to come to you and just tell you what they are going through, by default, nobody needs to tell you that you shouldn't transmit that message to the next person. That's how it should be. But because we grow or we are in a society where you cannot even trust the person you're talking to, people stomach stuff and will rather die with that with the stuff inside of them because they are scared of letting it out. They don't want to be embarrassed, they don't want to be disgraced, they don't want to be laughed at.
Yeah.
So we're
You.
having fewer people to talk to, and that's why I keep pushing people towards professionals, because professionals are binded by the loss of their career not to take that information out. But if you tell someone in your community that you just got diagnosed of HIV, the next morning, it's all over the
The
place.
whole part I don't know.
And that escalates the level of depression that you might be struggling with, because now not just one person knows about it, 10 different people know about it, and that's your privacy. It triggers, even it escalates the depression you're struggling with. So we need to be each other's keeper, meaning if I were to be vulnerable enough to share something I'm dealing with you, you should be able to keep it and
Yeah.
and talk to me without bias. And that's why I always tell people, talk to a neutral person, because when you are talking to someone who cares about you, in most cases their judgment will be biased, not because they are bad, but because they love you. And that's why even you go to a hospital, by law, a spouse cannot treat a spouse, because they'll be doing it with emotions. And that's
Yeah.
why you shouldn't be seeking advice from someone who is emotionally attached to you, because they'll be giving you advice with emotions. They will not be rational. But someone who doesn't have anything to gain or anything to lose, they will give you good advice without judgment and without bias. So let's now create a society of people that are trustworthy, so that we can, first of all, be each other's therapist. Even if we don't have the money to pay for a professional, we should be each other's therapist. Amongst my friends, I should have one friend who is that trusted friend that if I say something to that friend, till thy kingdom come, nobody will know about it. How many of us can swear that?
100%.
Because
How
yeah,
many of us? Even the men that used to be the ones that would keep things are the ones now that talk even more than women.
Yeah, because Coach B, there is a very thin line. Is like I must say, it's very difficult to be vulnerable at a certain point in life. There's a thin line like this, very thin, small line like this between a very good friend and worst enemy. And
Exactly.
usually that line is because a secret was leaked.
Yes,
That
and so
line,
people hold secrets as a bait, meaning try me, I'll let it out. Try
yeah,
me, I'll bring it out. And so people are moving, it increases your vulnerability. It even increases your mental illness, because now you're not just dealing with what you're going through, you're dealing with the fact that someone is holding it against you. So it's our society that is killing us killing each other. It's not that because Africa is less developed, we do not have the resources. The resources are as close as your family members. How many of us in our families can swear that we can talk to someone within the family about something we're dealing with, and it will stay within the family? How many?
yeah, yeah. It's very
Coach
it's
B,
very
let me ask you
minority.
this question. Let me ask you this question. So this girl,
You're breaking.
can you hear me?
Yes.
Okay,
Yeah.
this girl I'm talking about, see, it's not like it's just one time in a week. Call you at like odd hours.
Mhm.
You can call you at maybe 4 a.m. She'll
Mm.
call you 2 a.m. How can you deal with this type of person? Because sometimes you just ignore it. I cannot be answering your call like that every time. And then when you call, when you pick up, she'll be like, "Hey, there is day. How you doing? Oh, I was just up, and I wanted somebody to talk. Okay, what do you want to talk to?" She doesn't have a valid thing to talk about. She'll just be like, "Oh, it's been long. We've gone out. Where do you think? When do you think we can go out again?" Like the things doesn't even make
At 4 a.m.
sense.
That's because she's not sleeping. And trust me, she's not even emotionally aware that it's late to call you. She doesn't. She's not aware that it's late to call you. She's going by her emotions, and by it's from every indication those emotions are all over the place. She's not time aware. She's not people aware. She's nothing aware, and probably she could be suffering from what I would think it could be a psychosis, because one, she might be scared of being alone, and so she wants to always be on the call with people.
Yeah, that's true because the girl she married, I think she said they're in the process of the process of divorcing. So the girl now, the bad thing is that the girl, since they're on Facebook, the girl is posting the other girlfriend.
Her new girlfriend.
Yeah, her new girlfriend. And then
No,
after that, and then when they post each, when they post each other, they'll tag them like they'll be like, "You are the best thing that ever happened." I don't know because I also see the messages. I see the all the tags because I'm friends with them because I'm friends with both of them on Facebook, and I'm sure she's seen all those things. So now she doesn't have that girl she used to, like she almost. Because the girl used to like tell her not to be friends with other people because she was listening to them. Because one of my close, she's not talking to one of my close friends that they were very tight because the ex-wife told her not to because she was trying to advise her this relationship is not good for you. Now she doesn't have anyone to talk to, so she tried to like just call people at odd hours to like have a conversation.
Yes, so Mama Sita, there's something you talked about there that I think we need to be aware of. One
Yeah.
of the causes of depression or mental illness today is social media. It is
okay.
the number one trigger of mental
Mm,
illness, social disorder, trauma,
How?
and all of that.
mm.
How?
Wow, that is the trigger that is causing this lady to be distressed because
Yeah.
she is seeing what her ex is doing with their now girlfriend, and it's triggering her even more. And that's where self-awareness comes in. Every one of us needs to know what our triggers are. So if you know see the person, when you see the person for road, yeah, but let the job bite, you dey start
Oh,
vex.
that's it. Yeah.
Avoid you the person. You know yourself and you know that that's a potential trigger. Avoid it. So, but what we do is we know that this is our trigger, we go looking for it.
Now, could be you have said something very vital, avoiding the triggers. Now, there is this problem of unforgiveness, you see, having somebody that has done something offensive to you and seeing somebody that is a trigger to that particular situation. One of the ways you are, like from what you're saying, avoiding it is avoiding the person as a trigger. But what do you do that means in the rest of your life, you're just going to keep avoiding the person because I've seen a situation where you have to avoid somebody to avoid being triggered about a particular situation. But now it gets to a point where it becomes depressing. For example, a lady cheating on her husband with a particular guy that the husband knows. You see,
Mhm.
avoiding this guy that the husband knows could be some sort of trigger. But anytime you see that guy below the bite now, what if you try to live above that? You
Of
understand?
course, you will, but when you start again, when you're struggling with something that triggers your mental health, it's over time that you become accustomed to it. So, as you're still building resilience towards that thing, you need to start avoiding it. In some cases, you avoid it first, and then by the time you accept it, it's just like grief. I always say there are different stages of grief. Meaning, at the very beginning, you're in shock and you're in denial. And during that denial,
Mm-hmm.
you're avoiding anything that will remind you of that thing
Of
that
that.
happened.
Exactly.
Yes, you're avoiding it, but once you grow used to it, your system, your emotions grow familiar with that fact. After that, you will start bargaining. But what if I did something else? What if I tried something else? Maybe I will feel differently. And once in a while, you try to see the guy and then test yourself to know how you're going to react to seeing them. And if it's still triggering you as much as you can still withdraw a little bit.
Right.
So
Mm-hmm.
withdrawing or avoidance is a step to getting to acceptance. So it doesn't mean you're going to avoid that person, because if I say that, then it means if that person is your family member, how do you avoid them forever?
Yes.
You just get That's just a step to getting to where you become familiar with it, and then you build resilience towards it, and it no longer affects you. So
Yeah.
it comes step by step, and that's where you need to be very, very careful with yourself. You're training yourself to be used to this uncomfortable thing. It's like those of us, our brothers and sisters who are in Bamenda. When I grew up in Bamenda, I'd never heard a gunshot. Never. So for
Right.
people who are living there now, they've heard it, they started hearing it. they were in shock.
Very scared.
And
Yeah.
then they would start avoiding it, covering their ears. That's avoiding to hear it. But over time, when they keep hearing it, now their system builds resilience to it. And when they hear it, it's like deja vu.
That's
Yeah.
very true. That's very true. That's what my sister said. It's like a normal
Yeah,
thing now.
it's
It's
like
like
deja
because
vu.
yes.
This is the perfect demonstration. I went to Boya. I met my small nieces. They, you hear? Pa, 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 pa. I said, what? They asked for, they said they don't start the fry. And he said they don't start. And they come out. I left the next day. Like I could not wait. And I said they are already used to
Yeah.
me.
Yes.
Uncle,
Yeah, so
Uncle
they
is here.
build resilience. They build resilience. So it doesn't mean that it has not created some trauma in them. It
yeah,
has, but over time they've adjusted to it. And that's how all of us deal with some of these things.
Mm-hmm.
Some
yeah,
people will never get used to it. But majority of the times, the more you get used to it, then the faster you build
Heal.
that thick skin.
yeah.
Mm-hmm.
Because when you were talking, what you guys were, I know of someone that actually somebody they know actually attempted to sleep with their fiance, and now this guy has had the experience for about 5 years, and each time how I came to understand was that there was some time they were to recommend somebody that is a friend to the guy that attempted to sleep with the fiance that was flirting with the guy's fiance, and he just say no be na that boy if he same friend them I don't want to hear anything about them anything. And at that moment he still got, I'm talking about something of 5 years ago. At that moment he got angry and spoke about the story as though it just happened yesterday.
Mhm.
You see,
You
so
don't
what
Have you ever heard of
what
this saying that if snake bite you, you fear millipede?
yes, yeah,
Yeah, it's not that they've not gotten over it. It's just that they've conditioned their brain that anything that has to do with this thing, it's
you
no
know
go
what it
for me.
is.
It's no go for me.
Yeah.
I'm not doing it.
And when we're talking all of us, and one other guy, is in the US as well. He was like, "Bro, you cannot kill yourself for this shit forever. You at one point you need to. What if you try to live above the situation? I think it's going to do you better because if you look at it keenly, this guy, you people have you are in a similar field and you keep meeting people like that. That will be reminding you of it. And if you're forgiving the girl, it means every day you think about one, you go and create her problem. Every day you see, what if you try to live above it? That's why I made mention of trying to live above it, because at a certain point avoiding the person could be good to heal, to develop that thick skin like you said. But the truth is any day you see the person, the memories might come back, like the
It will
memories
come
might
back,
just,
but they will go
It
ignore
will
you.
come back. There's no way
yeah,
you can forget it. Yes, Mama Sita. You cannot forget it. It comes back, but the way you react to it becomes different.
Right.
that's when you must have outgrown the situation,
Exactly.
yeah,
And
learn how
people
to live.
outgrow stuff differently. That's one thing we need to know. Emotions are different, and some people build resilience based on their experiences in life. There's some people that have never experienced any degree of trauma, and so the one little thing that happens to them. There's some guys, let me say, that will go through ten heartbreaks and it doesn't mean a thing to them. But there
Oh
are
yeah.
just some guys that one heartbreak can just take them to an early grave.
Yeah,
So
they want to jump off the building.
exactly. So people are different. We
I
are
know one that
different.
is just that it's only rumor. Rumor don't make her you want get heart attack. Rumor is
Exactly.
not even confirmed. Yeah.
So different. We are so differently wired, and we need to empathize with each other. We need to be very, very patient with ourselves. And one thing that we struggle with in the society is we force people to heal from traumas. We force people to heal from traumas. We simplify people's traumas. Whether you lost your mom, if your mom was 80 years old, good for you. And if another person lost their mom who was 120 years old, they are going to grieve, they are going to be depressed, They are going to be, and all of that based on the kinds of relationships they had with those people.
They
So
had
we cannot be
exactly.
forcing people to heal from traumas. Hey, come over here. That gunshot, now no matter no. All this why waiting they don't shoot, you never be used to. No, people are different. We are all
Yeah,
wired differently, and you cannot
yeah,
force me to adjust to something. I listen to myself, I listen to my emotions, and it's
yeah,
it's going to be gradual to every individual differently.
yeah. Now, Coach B, for some of us that have these friends that will be calling when they want somebody to talk to, and you see,
Yeah.
these friends, there's one category like that with Mama Sita. Mama Sita's story is, you see, when she's talking, I smile because we know we are still having that phobia with that category of people. You understand? Now, people that are in that line that know, there's the one category of those that know until they are seeking aid, and there's another category of those that don't know. Like the one I'm talking about that just went abroad. I know that his own is that my head is hot. Now I just take one coup, but light man coup. Yeah, fine. You understand? When you have such people, how do you manage them? How do you talk with them? How can we help them? Yes.
I think the very first step is to empathize with what they are going through
Yeah.
and be a listening
Yeah,
ear to
like
them.
if our friend is you're not
However, at some point, you need to give them tough love, which is where you redirect them. You're not a counselor, you're not a mental health expert.
Yeah.
If they
Yeah.
are in the West and they can consult, you can help them understand their emotions. You say, hey, bro, this one that you're depending on this thing, for how long are you going to depend on this thing? Because yesterday you be there for the same state, you smoke the
The burn
thing,
am, the burn am,
you
the
never
burn am.
change. Today again, you still there with the same state, you dey still smoke, and you go depend on this thing for how long? Massa, try see therapist, no see what other one go help. It's not like you're telling them that, hey, the solution will be from a therapist. You're just giving that as an option. And as you keep saying it over and over and over again, they would definitely do it one day, because that is not a sustainable way of managing stress or depression. It's not a
Yeah.
sustainable way. It's just a short-term thing, and that might even cost you long-term issues. Yeah,
Yeah,
because
long.
you really start to depend on that thing for so long. Now, you potential don't bury and so. Now, your future you don't already bury am. But if you go to a therapist and talk through whatever that trauma is, whatever that thing that caused you to be depressed is, it's going to reinstate you, and then you would pursue your life normally. But if you want to self-administer ways of managing your stress, that's when you would depend on alcohol, you depend on drugs, you depend on other things, which are all the wrong ways. And that's what we're doing. You see somebody change gear every day, but where the month na some heartbreak wey we don't get that so many years ago. Same
we
thing with woman. You see some woman dey switch man from today and tomorrow, wey dey surely suffer now from PTSD, when are from some RAPE so many years ago. So there's a lot, Mama Sita, a lot
see,
going on.
this one. That's what I'm like. I don't know if there's a solution to this. Like, this girl, she doesn't hold a job for up to 3 months.
You see?
She goes there, either she's running late because she doesn't even have a car. They don't can take motor go because she cannot pay insurance. Even some most of the time she tries to call me through Facebook, because now she cannot even rent, because she used to be here in Rochester, but now she moved to Buffalo where her mother is. So
Mhm.
now she doesn't have a phone. She was using her Facebook to call me, or she used her mom's phone to call me, because she, even to her phone she cannot even pay it.
Wow.
Yeah, it was it is that bad.
And she's probably making all her money, and she's using it to buy stuff.
When she has money, she will buy alcohol. It's not even the small one, that vodka mixing kind of stuff that she's buying. She called me one night, I think it's last month. She was like, "Can I borrow her 50?" She called me, it was like 1 a.m. I was still up because my baby was up. So I picked. She was like, "Can I borrow her a $50 that I'm paying her the next day?" I said, "See." So sorry, I almost called her name. I said, "See, at this time I know what you want to do with the money, and I can't help you, because when she takes it, she will not buy food. She's not paying any bills because the mother is doing everything. So I spoke to the mother because I was, when we were working together at one the somewhere we work together. So she
Mhm.
always, she calls her mom. She will like she will connect me to talk to her mom that, oh, it's my friend, all those types of things. So I was used to the mother. So I tried to call her mother that, what are they doing? She said, yeah, she have tried and she's not even listening. She have told her to stop this thing, alcohol. She sleeps in the basement. So when they like, she would tell her mother, okay, she have heard. Then when they give her money, first thing is to go and buy alcohol, then come and hide it in the basement. Then when people goes to sleep, that's when she goes now to drink. That was the mother that. So that's what I'm like, I don't know her own case. They have tried to take her to rehab, it's not working. Liver is not functioning. All this, so,
Well,
so it's like too much for that girl. You see, she'll come and post some kind of things on Facebook like, "Oh, I'm really going through a lot, and nobody's here to help me."
pity party.
Yeah, and then I was like, when I even want to talk to her, I'm like, "See, I've tried so many times to tell you to stop drinking. The first thing you have to do is to stop drinking. Try as much as possible to stop drinking or go for rehab." She will tell you that place is boring. That place is like a prison. I'm like, yes, it's a prison to make you, to build you up, maybe to stop all those
Mhm.
things doing. And
Yeah,
this,
you see, that is the case of probably mental illness that was not addressed early enough, and now she's depending on alcohol to manage
that's why if anytime I see her with the bottle of this water bottle, I have to smell it. And every time she's coming to work, she's smelling alcohol. You know, alcohol, you cannot even hide the smell when you smell it.
Mhm.
Making people, that's what is making those employers to kick her out. She will come here, she's running late, or she's smelling alcohol. It's not everybody that wants alcohol.
I know, right?
Yeah, so all those things is now she cannot have a job around Rochester. She's back to Buffalo. I don't know if she told me she was going to another interview last month. I don't know if she got the job. I still have to call her ask. So is that bad? Depression and anxiety. And taking, when they say that taking she's taking medication, that's strong medication for anxiety. Anxiety. So when she's shivering, her anxiety is bad. She shivers when it starts.
Right.
I'm like, at 35, she has so many things. She's going through so many things. I don't even know.
Wow. I had to
I
connect
will
my
have
phone.
to leave you guys. I'll
All
have
right,
to.
Coach B, thanks so much. Thanks so much
Thank
for
you.
being with
Thank
us.
you.
And
I was interested.
sincerely, I really appreciate you for creating this time for us to have this conversation. And I'm
Anyway,
sure a lot of people were also blessed. Oh, Mama Sita is live on camera.
how
Oh, it's dark.
Always. It's almost dark already here,
I
as
think
you can.
we need to have a part two of this so that we can hammer out on some other. There are some other topics that I would like to evoke. Yeah, that are similar because
ah,
sometimes we just hit around. We don't actually hit some other points. So maybe
That's
when
true.
handling the next one, we might bring in some people to come and share their experience as well. Yeah, I'll do my best to see how we can handle that and maybe help a few people and start by implementing the practical steps of getting in contact with the right persons. Yeah, so maybe we would also need to do research of people that are available maybe in Cameroon and other parts and even online that could help those who are suffering from situations like this. Because sometimes we must not always allow it to get to a very chronic state before we take action. If we can
Exactly.
always handle it at the basics, at the startup, it can help a lot. I mean, look at this one battling with kidney. There are others
Yeah.
battling with lungs because this situation will always push us to do things that will make us to start battling with the actual health.
Right. Right.
You see, yeah. So I think that could be really a good thing. Thank you so much, Coach B, and
No problem.
wishing you
Bye,
a
Mama
blessed.
Sita.
I don't know if
Bye
it's a
bye.
blessed day or it's a blessed night. Yeah. So, Mama Sita, you see, these are different experiences. I mean, it's really pathetic to have somebody as young as 35 battling with things like that, and I'm sure she thinks she's going to DIE. GI if he doesn't get anybody, and it's causing another anxiety and pressure again on her. I mean, you see, why not? How did you do that kind of marriage again? No, when you talk about that, it's too bizarre. Yeah. So that's the thing. A lot of the time, we actually suffer a lot because we take the wrong approach. We take the wrong approach. We don't meet the right persons, and we don't do the right things. And definitely, when we are faced with situations and we don't do the right things, we definitely end up having wrong result or results that are not right. You see, these are actually some of the things we do and a lot of mistakes we do. Yeah. So in what I have gathered the most is do your best to actually talk to a professional. And if you're talking to somebody that's in that situation, like some of us that have people that are talking to us who are in that kind of situation, you need to do your best to tell them to seek a professional. Coach, we said something like you will keep telling them, and one day, which means we need to be persistent about telling them because most of the time we say, boy, leave, I don't need therapist, I don't need therapist. Especially with those of us that are not really familiar with mental health issues, we actually tend to neglect it a lot or pay little or no attention to it, whereas it is the foundation of the crisis. You see, so sometimes we just need to talk to a therapist and encourage others that are in a similar situation to do same. Talk to a therapist. I mean, that could be a very big, nice solution. Yeah. So I think those are some of the things that we could gather and do your best not to be alone. Try to share with someone. They say there's a popular saying that a closed mouth is a closed destiny. Even though sometimes when you open your mouth to talk to person now, so now it bring you more depression. You get. So those are some of the things. It's always available to reach out to someone you can talk to. Try to share your experience. Sometimes you just need somebody to talk to and you're fine. Like there are many times people just have this experience that I just want somebody to talk to. When you exchange with somebody that can listen to you and that can speak with you, just giving a listening ear can actually help your situation. The next thing is maybe even getting people with like similar situations that we're able to overcome or that you are like you encourage yourselves. Those are possible steps. I think in our part B we are going to hit hard on some of these solutions. Now, Mama Sita, are you there? Oh, you better say Mama Sita, don't vanish too. Yeah, it's not really easy having this. So please, these are some of the tips. As I believe from what Coach B has said, we have gathered a lot. Those in developed countries, do your best to get a therapist. Those here, I beg, let's avoid my head hot. Talk to somebody and get professional support. If you can't do that, just talk to somebody you can trust. Talk to somebody that you can like just be open because sometimes keeping the poems to yourself might just help you to stay in your vulnerability and do things that your vulnerability can permit you. Those of you that are saying my head is hot, remember when you take this fighter, Leon Dor, and all these things, it has damaging effects on your health itself. Kidney, lungs, your internal organs. You need to watch them closely. If I've been known over 100%, so avoid doing certain things that will put you in a state of if I've been known. One nice word is that in as much as there's life, there is hope. If you're alive, you can see get a solution. You can get a solution that's going to take you out of that situation. It's just a transitional stage of your life. And if you're strong enough with strong morale, you can actually overcome this particular stage at ease and actually get back to a life that you've always lived or the life that you wanted. Many people you see have been through this stage. And when you overcome it, you become a better person. So be patient enough with yourself and seek the right approach to handle certain things like this. Now, before I leave the studio, I want to let you all know that we have our Laughter Extravaganza night coming this Friday. And Friday, the 29th of November, is going to be a night of blaze, entertainment, and glamour. Night will have red carpet from 5 p.m. We're going to have comedy presentation. We're going to have musical presentation. We're going to have the Miss Natural Challenge. We're going to have stand-up comedy and a whole lot more. We're equally going to project the movie Bonus. So those of you who have seen Sweetest Beings, Lee Brown, and all the characters commenting, come and watch this beautiful piece, and you won't regret you did. The tickets are very available and affordable. In fact, they're almost free from 2,000 francs, 5,000. From 2,000 francs, you have console, you have something to consume. 5,000 francs, you have something to consume. 10,000 francs, you have something to consume. Up to 100K. Now, Mama Sita, welcome back.
Deliver, I
Oh,
get the right. The
I get. All right. Do you have some final words before we pack our bags out of the studio?
See, the thing is, don't take too, don't if someone disappoints you, don't take it seriously because it might lead to one thing to another. And be careful with the kind of friends you have because there are some people that will always want to gaslight you and there are people that will always want to gaslight you. So be careful the friends that you keep and be careful to who you tell your stories to because another thing can start from another one is maybe from what you told your friend and then she wanna not everything is content. They wanna sell stories to make content.
Kongosa?
Yeah,
They
yeah.
say the Kongosa? Or is that make content?
I swear. So be careful who you tell your story to, and heal gradually. If they say don't do this, your doctor say or your therapist say don't do this, please don't do it. Because my friend is suffering because she did not listen to the therapy. She did not go to rehab. She did not do so many things they wanted her to do. Now she doesn't have a kidney. She's begging left and right. So relax and talk to the right people. I guess
Yeah.
we'll continue this topic next week because I'm saying that because I walk to where people I work where like people who are suffering from these things. If you see the medication they talk about, we in Africa we need to take medication for help we suppress some of these things that we are going through. So
We just do anyhow.
I swear, you're a sick person, all kind, do what we go, take the one for. So let's just be careful and let's take care of ourselves first before taking care of another person. I hope we'll be
Yeah.
back with this
Yeah.
topic.
Very important.
Yeah.
Yeah.
So,
Yeah, for sure. We're back again next week to talk about this in another detail and with more insights again. All right. Thank you all for being there. See you all on Friday. Laughter Extravaganza night. It's going to be a
oh,
golden night of
Friday! Okay,
bliss,
Friday we have
fun,
the
entertainment,
laughter. Friday we have
laughter.
the extravaganza
Yeah, yeah,
night.
yeah, yeah.
Yeah.
Yeah, Laughter Extravaganza with one very big mamacita that is making the table available. Sorry, sir. Don't talk.
Us we love. All right, guys.
Yeah. All right.
My
Okay.
driver
See
said
you
I'm
all
picking
next
up.
week and have a wonderful Sunday.
Okay. My driver, assistant driver. The man know I said you don't know 20 do.
Man.